Okay, so I'm pretty sure everybody has heard of the little jingle that goes, "Let your new life begin. Call 1-800-GET-SLAM." Yeah, so obviously America is becoming increasingly obsessed with the way they look and if you drive down like the 210 freeway, I'm pretty sure you're going to see like at least 5 billboards that go like, "Oh, lose weight, call, it works," and all that stuff. And all the weight loss promoting is in commercials and it's in radios, and all you hear are the positive outcomes of, "Oh yes, I've lost dress sizes from 14 to size 2, and I've lost 44 pounds in the past 2 months." And yeah, so all you hear are all the success stories. What people don't see in these commercials are the negative lifelong effects that these surgeries can cause. My main claim is that weight loss surgeries are a harmful way to lose weight. The surgeries that I will be talking about specifically are gastric bypass surgery and the lap band surgery. The difference between these two is that the gastric bypass, there's 2 of them, and the most common is known as the RGB, and it's an operation where the small stomach pouch is created by stapling part of the stomach together or by vertical banding, and it limits how much you can eat. The other one is called the extensive gastric bypass. This one is more complicated, and the lower portion of the stomach is actually removed. The small pouch that remains is connected directly to the final segment of the small intestine. And this one is more, you see the rapid weight loss within the first 3 to 6 months, and your final settling weight is about 10 to 16 months after. Also, this one is not reversible, and there is no significant hardware in your body. The lap band, however, is a similar operation. It involves creating an egg-sized pouch in the upper stomach and attaching it to a section of intestine. It's a slow, steady weight loss, and your final weight loss comes after 2 years. This one has more of a long-term, non-reactive plastic material in your body. Okay, so my supporting claims will be that number 1, weight loss surgery is not the easy way out, and number 2, weight loss surgery patients will still struggle after the surgery. So my first claim, there was a study done by a surgeon, Dr. David Slum, the University of Washington. It showed that people in their 30s and 50s, most common ages for obesity surgery, found death rates well under 1%, but among 35 to 44-year-olds in the Medicare study, more than 5% of men and nearly 3% of women were dead within a year, and slightly higher rates were seen in patients 45 to 54. Among patients 65 to 74, nearly 13% of men and about 6% of women died. In patients 75 and older, 50% of the men and 40% of women died. Dr. Flum said the risk of death is much higher than it has been reported. It's a reality check for those patients who are considering these operations. The study involved 16,155 Medicare patients who underwent obesity surgery between 1937 and 2002. It was later published in the Journal of the American Medical Association. The risks are that leakage of stomach contents into the abdomen, which the acid can eat away other organs. Most common are nutritional deficiencies causing health problems, and also breakdown of the staple lines, which is band and staples fall apart, reversing the procedure. For my second supporting claim is the weight loss surgery patients still struggle after the surgery. According to Paul Ernstberger, PhD, Case Western Reserve School of Medicine, the operations work by forcing the patient to consume small meals. If a meal of more than 3 ounces is consumed by the patient, they will vomit. He also states that the difference with the surgery is that the arrangement of your digestive tract is permanent, so are the side effects, even though its weight loss is temporary. Unlike every other kind of surgery, they are tested on animals, except for these ones. Does that make sense? No? Okay, like every other operation is tested on animals except for losing weight. Okay, so some surgeons say that the surgery is so wonderful, but clearly it's not safe. However, most gastroenterologists don't recommend weight loss surgery because they have seen the health problems it can cause. Okay, another one. Patients who have undergone weight loss surgery already know they have to watch how much they eat after the operation to keep the weight off. Now, however, there's a study where they also have to watch how much alcohol they consume. So, after the surgery, patients get tipsier faster and take longer to sober up, says a study researcher, John M. Morton, MD, and is the director of bariatric surgery at Stanford University School of Medicine. He quotes, "One drink could be enough to place them at risk for DUI." So pretty much the study was they compared the effects of drinking a 5-ounce glass of wine on 19 weight loss patients, and they pretty much checked every they had to drink it by 15 minutes, and they checked every 5 minutes of how the alcohol affected them. And the results showed that that the surgery patients had an average peak alcohol breath level of 0.08, which is enough to be declared drunk when driving a motor vehicle. The non-surgery participants had a level of 0.05. So another one, like the time's way off, so sorry. Another one is some patients will have a result of excessive skin, and I've seen on True Life the documents of patients that have excessive skin, and they're still suffering from the way how their self-esteem is low and how they don't like the way they look. And so overall, my main claim was that weight loss surgeries are a harmful way to lose weight. And my supporting claims were that weight loss surgery is not necessarily the easy way out, and the weight loss patients still struggle after the surgery. Thank you.
Right, it is taking you a while to get through some of the points, and so that's an issue you need to do a little bit of editing on. I like the, excuse me, I like the attention device, and you do finally specify what the claim. It's almost 2 minutes and 48 seconds into the speech before you lay out what the main claims are. You get a whole bunch of background stuff defining what the two surgeries are. You need to have a simpler way of defining them that gets it out of the way. And basically your criticism is of both of them, regardless of which technique it is. So if you just said, you know, the two which have slight differences in the way they are done, both create these particular problems, that's as far as you probably need to go on it. You don't need to go into all the other detail on that. The internal signposting is pretty good. I thought you did a good job trying to present evidence to support your conclusions. There's some scary statistical evidence. I mean, let's face it, if your death rate is 6%, that's like spin the wheel 1 in 20 shots. You know, I've taken worse odds than that in roulette, so I'm not sure that that's all that comforting to think of that. And then you have, of course, I think some of the other problems that you're talking about later on. I think those don't get a chance to be developed as much. The excessive skin, for instance, the problem with coordinating what your diet's going to be like after you've had the surgery. You do mention the problem with the alcohol consumption. I think that those things develop that point a little bit more effectively. You did qualify most of your evidence, and sometimes what you do is you get sidetracked on these other issues like the animal studies, whether or not it's done on animal studies, what difference does that make? It's not a big part of your argument. Describing the complexity of the study, I think that sometimes is also more than we need for this particular assignment. All right, thank you.